Hi everyone, thanks again for joining us back live at the GuideWell Insights Lounge. I'm here with Sam Srivastava. Sam, welcome to the interview.
Thank you.
Sam is the CEO of Magellan Healthcare. Sam, Magellan Healthcare works really with all facets of the healthcare industry. You work with payers, you work with government, you obviously work with consumers and providers. How have you navigated the market dynamics, especially in this past year, even in the last few months, and still maintain a successful focus forward on the consumer?
That is a great question, and I think it's a great question for all of us. The industry's consolidated both horizontally and vertically. So you've seen large payers consolidate horizontally to build more scale. You've also seen that happen in the PBM space as well. And then vertically, there's a lot of integration of people trying to move down the value chain and having more the value of convergence across the patient and the consumer. And so from our perspective, it really presents itself as an opportunity. You need to be able to talk to the 7,000 professionals at Magellan, but also to your leadership team to say, you need to stay client focused. What does the client need in these turbulent times? And a lot of our clients need stability. They need transparency because they now have to deal with the new competitive environment. So if I'm a health plan or a state government looking to balance a budget or to be able to hit an earnings target, now with the consolidations, there's more change. So we actually represent the opportunity to embrace and take advantage of the change. So from our perspective, people can stay focused because there's an opportunity for each one of these constituents to really look to us for more solutions on how to coordinate care more effectively, and then fundamentally, then deliver better care to the consumer. So, so from that perspective, it presents itself candidly with more opportunity than risk.
That's a great outlook. You know, Sam, one thing that I know that you've mentioned in past addresses and other things is the importance of big data. You want to be able to keep your population, really use predictive analytics so that you can anticipate where your patients might be sick tomorrow so that you can intervene today. Can you give us a little bit more insight into how you're using big data at Magellan?
Great question, and I think we have a competency and a deep competency in kind of our traditional analytics in understanding historical healthcare costs and then the predictors of those in the future. But we really need to push the envelope and move further into this space in order to understand not just how individuals, what their claim history has been with laboratory tests and with going to the hospital or going to the doctor, but also marrying that up with data about lifestyle, with the choices I make in terms of the purchases I have, what I like to buy, where I live. Those sort of add to the predictive capability set that we're starting to add to our analytics to make them more advanced. So we can tell you now that if you've been in the hospital and you've had a certain set of lab tests, the predictive value of you going back into the hospital. But we can make it even better by knowing your lifestyle issues and what you consume. And that's where the puck is going, if you will. I need to be able to, and we as a company need to be able to customize for our client or customize for the consumer. So you use the big data and analytics to be able to the patient engagement has to be custom to the individual. You may personally like to have phone calls. Some other folks may like to have a face-to-face meeting. Others actually would like to much more engage on the web and on their phone. So from that perspective, the next wave of big analytics and big data for us allows us to have more propensity modeling and to understand individuals' preferences to be able to engage as well. Not just that we think they're going to have a cost issue, but how do we wrap a system around them that allows them to engage where they are. Does that make sense?
Absolutely. So it sounds like you're really personalizing that care delivery, which clearly is going to benefit the consumer, but it is truly going to hopefully keep them healthier today so that you have fewer situations where you need to worry about their health tomorrow.
Correct.
Yeah.
And I think we're facing the challenges I think that a lot of others are. We have a deep, rich data set in behavioral and in pharmacy and also in specialty health, but we need to augment those data sets with the physical health data that we may not have, but we also need to augment it with that lifestyle data that I talked about as well to get to the preference-sensitive personalization, which is where medicine's going and where patient care is going as well.
It's been a huge theme at this conference too. So I was going to pivot just a little bit. Certainly with the client base that you serve, I'm sure that you're well aware of the tragic stories that we continue to hear of where people with mental illness are jailed instead of receiving the compassionate care that they deserve. What can communities do to more effectively address these populations' needs in a way that makes sense, when we know that budgets are certainly not limitless?
It's a great question. It's a challenge for us as a society. It's more than the time we have perhaps to talk, but I can tell you that at Magellan we've had deep history in behavioral health, and being able to help actually build crisis systems, work with juvenile justice and work with prison systems, and then work with folks with behavioral health issues. What we found as a recipe that helps, and a formula, is not only to help people with their actual treatment, but also help them with resiliency and having peer supports. So the ability for, whether it's you, a family member, or other friends in the community, to create a transparent peer support group to help an individual identify an issue and keep them on course is critical. And then community agencies coming together as well. For example, in Maricopa County, we've provided for many years the behavioral health care for the Medicaid population, the low-income disabled population. And there, we were able to reduce the suicide rate by 67% over a 3-year period.
Wow.
We started by, only 1 in 25 people who think about suicide actually commit the suicide and go through with it. But the other 24, we spent a lot of time interviewing, doing research, and understanding that at that moment in time, they really didn't want to pull through and actually commit. And we then built safety net systems around the individual to say, if I'm having a crisis event, how can I talk to someone to be able to come back down? How can I have peer supports? How can I also engage in a confidential way that may not break stigma as well? And so we work with community agencies in a public health approach to be able to drive really suicides to zero. And we're doing something similar with the veteran population as well. It's sad to say that almost 22 veterans take their life a day. And not to go too deep on this, but more military folks have died at their own hands than in 1 year than combined that we've had in active military service in the last 5 years. And our learnings from a lot of that relate to 2/3 of those people that actually went through with that actually didn't go into the VA system for care 6 months prior.
So they were outside of the system.
Exactly.
Right,
so it's incumbent upon us and communities to, 1, be educated and aware, and 2, to have a public health approach where you're working with crisis systems, juvenile justice, justice systems, but also working with community mental health centers and nonprofit agencies to be able to help identify, educate, and create peer supports. And so I think it's something that we can kind of think about globally, but you have to act really locally, and it's a community by community basis that we do this. It's a crisis in our country today, and it's a real opportunity for us to kind of build those support structures moving forward. Sorry, I didn't mean to go deep on it, but it's an area of passion for us.
And obviously, and I think that so many communities are truly struggling with it, so it sounds like Magellan is really helping to model a potential solution to this. So we're fortunate to have you working the way you are with those community partners.
Thank you.
Yeah.
What we'll do actually in a moment of crisis where there might have been all too often these shootings that occur on campuses, and what we'll offer up is we'll offer up our EAP and our clinicians on a 24/7 basis with a hotline, and we'll also send, at no charge, we'll send our clinicians to the market to be able to work with the schools and work with the victims and their families in the process, because it's just a part of our mission to be able to improve health, especially the behavioral health of individuals.
Well, I think too, part of the success of Magellan is the fact that you're integrated and you have this holistic solution. What is it that the larger health industry can learn from the model that Magellan has adopted?
It's a great question, and I think candidly we all have a lot to learn from all these innovative models. I couldn't be more excited about what you see here at the Oliver Wyman Innovation Conference and the level of innovation that's occurring. But from our perspective, I think the lessons learned, we partner with health plans, we partner with employers as well as state governments, and our learning is really that we have to, for the individual consumer, we have to be helpful, we have to be easy to use, and we have to be kind of affordable. And those are 3 really important things. But for our clients that I just mentioned, what they're looking for is interoperability and lowering costs, and not having a lot of noise, so having a good patient experience. And so from our models are really focused on having clinical models of care that are integrated with the delivery system in that local market. So if the health plan or the state is looking to transform a certain geography, it's incumbent upon us to work with community mental health centers, federal qualified health centers, to work with the hospitals to be able to embed our state's behavioral health, the specialty health capabilities,
right,
into how they're managing care for a fully integrated approach towards patient care. And what you'll find is our models of care are adaptable based on the market. On the West Coast, we partner with second generation IDNs and ACOs. On the East Coast, we work with integrated primary care practices because the health plans really drive that there. So we're finding that you have to be adaptable to how the model of care is delivered in that area. So each provider is different in their level of organization, transparency, and understanding and ability to embrace population health risk. So we at Magellan, and our learning and maybe our comment to folks are, you have to be adaptable and you have to be kind of ready when the market is ready in that local market to be able to accept population health risk.
So it sounds like you really know how to evaluate what the pain points are.
Correct.
Both at a global level, but really at that micro level too, which
Correct.
is so critical for that adoption and for that uptake. So really to most benefit and really capture the greatest number of potential clients, that seems to be the right approach to me. So
correct.
Yeah.
We talk a lot about consumer hassle maps and what the end consumer would see in an ideal setting. The reality is you need an ecosystem hassle map because each geography, the products that they're in, the life stage that the individual's in is very different. And so what may work in Boston, you'd love to say would work in Miami, but it may not because of the way the delivery system's established, the products that you might be servicing,
even
and
just
the
your
benefits you have.
demographics, I'm sure.
Exactly right.
Right.
So it's not just about consumer hassle map, but also the ecosystem has to be mapped very effectively to then figure out how can you create the most value.
Well, Sam, you have such a fascinating perspective. I'm so delighted that you were able to take some time and spend with us here in the GuideWell Insights Lounge. I hope that you enjoy the rest of the summit. We look forward to catching up with you again sometime in the future.
Great. Well, thank you very much.
Right.
I really enjoyed it.
My
Thank
pleasure.
You. Take
Thank
care.
you.